Okay, I'm a photographer too, so I'll start getting my
Yeah.
camera out. I have
Yeah,
a little
get your
loop on it.
camera out, right? And I don't know, work on rotation, right? With the lens, right? I mean, you can make rehab every single element of your daily life, right? You just have to give yourself a little bit of extra time, or maybe a lot more time, to try to do the task.
Hey everyone, my name is Dr. Nick Housley with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Okay, I have another real quick question. Of course,
Sure.
my fingers are like stiff, and I sit around, it sounds crazy, but I sit around and stretch each one of my fingers all day long, off and on. Is that okay?
Yes, provided that it's not actually causing an alteration that balance. So let me say this. Fingers are really quite intricate in terms of their design, or I guess the evolution of the hand, right? A lot of it is tendons. There's a lot of tendons and ligaments that are actually there that help dictate how your fingers move, right? If you get it wrong, you can get something like what's called a swan neck deformity, right? If you get an alteration in those individual tendons and ligaments, and in some cases it can get so altered that they can sort of rupture or split, you can get these weird deformities in your fingers. And so I think stretching to alleviate pain, stretching to help weight bearing to improve that sensory feedback can be useful, but I wouldn't want you to necessarily do it 24/7. I think because what you can do is you can start to physically change the structure of your tendons. And when we start to get back that motor control, we may not have the tendons in their normal fashion to leverage once we want them to be there, right? If you stretch them to the point of they're too compliant and a muscle starts to pull on them, nothing's going to happen, right? Because I don't actually have a rubber band, but you can imagine a muscle is here, okay? You have a muscle that can volitionally contract, but on the end of this, it has a tendon. And this tendon, what has to happen is this muscle contracts, and then this tendon has to then apply that force about the muscle or the bone that's on this side. And if you, for whatever reason, stretch your tendons too much, that they are so compliant that when your muscle contracts, this tendon is just going to stretch. And it's not going to actually impose a force on your bone, cause any movement. So we wouldn't want to necessarily do it too much, because we can always do things in extremes. So I would do it for comfort and pain reduction and tone reduction. Do it for some weight bearing, but I wouldn't encourage you to do it into extremes.
Okay. The other thing is I make jewelry, and so I have all these pliers. Periodically, from time to time, I put my plier in my hand. I haven't been able to move it, and I can't do it today, but once in a while too, on my left hand, I'm able to touch my index finger and my thumb together. Not all the time, like maybe 2 or 3 times a week.
Okay.
You know? So
okay.
I don't know. I'm just trying to, like everybody else, I'm just trying to get my movement back, because there's some things I want to do. I was really encouraged when I heard the lady talk about she was a pianist and she was practicing, different things. So, like, is it okay for me from time to time to put my plier in my hand?
Betty, yes, do it all the time. Do that as much as you can. I think whatever your most cherished task is, if you are a jewelry connoisseur, if you are a craftswoman, get back to doing that as much as you can, because what you're going to do is that's going to be your assay. That's going to be the thing that you're going to know when you start to make real progress. And so the more you can integrate those functional tasks in your daily life, the more you can integrate your left hand. Is it going to be as efficient? No, that's okay for right now. But the more you can integrate it, the better.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
And so I would very much encourage you, and actually I do this with every stroke survivor that I work with formally, is I use the Motus hand for kind of priming, right? It's kind of priming the pump. And then I will actually transition immediately into a functional task that person really cares about. With some grooming activity for Martine, it's let's play piano, right? Let's sit down and let's start to do some tasks, repetitive stuff. For you, get the pliers out, whatever it is. I would certainly encourage you to do that. And I cannot emphasize that enough.
Okay, I'm a photographer too, so I'll start getting my camera out. I have
Yeah,
a little
get your
loop on it,
camera
I
out,
can
right?
put
And
on the
I don't
phone.
know, work on rotation, right? With the lens, right? I mean, you can make rehab every single element of your daily life, right? You have to give yourself a little bit of extra time, or maybe a lot more time, to try to do the task, and just recognize that, hey, it's not going to be as pretty as it was before, but the more you can incorporate your left hand specifically into your task, the better it's going to be.
Okay, one other quick question before, I know you want to see all my hand and stuff on the machine, but one other quick question. I also would love to do the foot mentor because I have foot drops. I am able to walk with a cane for a short distance, and I keep doing that. I keep working that. But I was about to say, okay, I'll just stop doing that hand because I can't afford both of them at the same time. I'll just stop doing the hand mentor and do the foot mentor. And one of the people I talked to said, talk to the doctor about that, because before you start looking at changing what you're doing, they want to look at like 500 hours maybe on the hand mentor. That should be looking to keep up a certain amount of time before I switch to the foot mentor. What do you say?
I think there are no hard and fast rules about at this threshold I can stop. That number does not, I do not know that number for you. No one at this point in time in science can tell you that number. Anyone that says they can tell you that number, they're just lying to you, period. What we can do is we can say that it is going to be conditioned on your outcome. And the thing that I would encourage you in terms of when we'd want to transition is, when is the intervention delivered by the Motus hand not being as efficient? And what I mean by that is when we stop being meaningful progress and we have sort of exhausted all of the knobs that we can turn with it to make it more difficult, to make it more challenging, whatever those knobs are, whenever we've kind of turned all of those knobs and Betty is not making any more progress with your hand, that's the point when we need to consider either changing something else, maybe even taking some extreme measures and going real high doses, but that's a different topic. But that's when we want to
What was that?
Go really high doses. That's a topic for a different time. But at that point, when we have an outcome that is no longer responsive to the intervention, that's when we want to transition.
Okay.
Because outside of that,
I've gotten up to, I'm trying to do 2 hours every day now.
Sure. Yeah. I mean, yeah, you mentioned a number like 500 hours. I'm like, I think you're probably in the right order of magnitude in terms of numbers of hours. But the thing is every stroke driver is different. Every single person's responsiveness is very, very different to interventions. All of us bring unique anatomy. All of us bring unique life experiences to this, right? So, Martine has a past life of being a classic pianist, right? Her brain is going to be different than your brain or my brain is, just because she's spent, I don't know how many years playing piano. And so our brains are different. Our responsiveness is different. And so I think it's very much more appropriate to think about, well, these are rational rates, right? 10,000 hours, way too much. 2 hours, very, very not enough, right? If we look at the literature, kind of the best estimates are in that kind of 100+ hour range. And this is actually very consistent with our clinical trials. When we ran these, those individuals got between 100 and 200 hours of rehab, and we saw what are called minimally clinically important differences at those time points. Now, some people take longer than that, and some people can actually continue to improve. The thing is those clinical trials were just capped at a certain time point. We had to at some point say, okay, we're going to stop and we're going to see it here. And that just happened to be at 150 hours, 200 hours. But individuals can still respond beyond that. And that's, there are some really nice studies, specifically from Catherine Lang's group and a bunch of other neuroscientists, my colleagues around the country, that are studying that phenomenon. But we don't know what those numbers are. We just don't. And so I very much would recommend taking the tack that I just described, insofar as we monitor your progress. And the moment we stop getting positive responses, that's when we need to have the question about whether or not we want to proceed or switch over to something else. Okay.
Okay. So you want me to put my hand mentor on?
Well, unfortunately, Betty, I think what we're going to have to do is we spent a lot of time talking through questions, and we're going to have to potentially go through maybe another time. I'm not able to. Is that okay?
We can just schedule another time.
Yeah, because I think it was really important to get your questions answered. I think that information is very,
I appreciate it. I really do.
of course, and you could tell it was a hardship for me, right? I there's no, no, I honestly, I love answering questions. It's so fun because everyone, I think my brief soapbox is that providers don't always have the time to give you guys insight into things, and I very much appreciate the opportunity to be a conduit for information for you guys and be a resource. And so I'm very happy to answer questions for you.
Thank you. Sometime in the next few weeks, I'm going to start more what they call occupational therapy. So we'll see how all that goes in combination.
Great. Yeah. And if you want to bring your OT in on one of these, bring your OT in and let's talk about how we can kind of end things together. I think the more skilled courtesies we can have helping you, the better, right? And we're all kind of a team here. So want to just extend an invitation formally to you and to your OT.
Okay, great. So what do? I just call or somebody will call me and I'll set up another time?
Yep. Well, what I'm going to do, I'm going to take a note here and I'm going to recognize that we did not actually get a chance to do a formalized assessment with the Motus Hand, and we'll get you scheduled for one of those as soon as possible. Okay.
Okay, great.
Okay. Yeah. And of course, Betty, it goes without saying, this is true for everyone. So Scott and Dylan and Stacy, if you guys have questions for me, just reach out to me and I'm here to answer questions. And so just reach out between now and our next sort of formalized time. And we'll jump on a call if we need to, if something's urgent, or I'll just do my best to get you a response. Or oftentimes I'll try to do a video response. That way you can kind of see me do the thought process, and I can kind of giggle at myself when I try to make something cohesive and realize it doesn't actually work that way. But that's okay. So just let me know, and I'll try my best to get you an answer.
Okay, thank you very much. Appreciate it.
Of course, Betty. It was great chatting with you, and I look forward to our time together formally with the Motus Hand. Okay.
And it was a lot of help. I appreciate it. It really was.
Yeah, excellent. Very good. Okay.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.